In the practical exam, in theory exam, you should know that, for example, in practical, I'm going to show you or give you a vertebra and tell you this vertebra belongs to which region. Or it is possible I ask you, this vertebra is T1 or it is T12. Some landmarks are going to help to you to distinguish very rapidly, very quickly. At the first, you should know each vertebra, each typic vertebra consists of a body that it is visible anteriorly. What is anteriorly? Anatomical position, it is in front. Okay, for example, eyes and the ears. The position, which of them is anteriorly? Eyes. The eyes position compared to the ears, the position are anterior. این هم شده در چه؟ میتونم بهشون توضیح میده که مثلا این برگشتن به If you imagine, here is anteriorly above the vertebra. The body of the vertebra, the position is anteriorly. Posterior to the body, we are going to show you the vertebral arch. So vertebral arch, the position is posterior, and the body of the vertebra, the position is anterior. You should know some of the vertebra, such as the first vertebra in the cervical region, we are not able to show you the body. The first vertebra, the first cervical vertebra is without the body. Okay? But here, I'm going to explain for you a vertebra that it is a typic vertebra. A typical vertebra, anteriorly, we are able to show you the body. Posteriorly, we are able to find the vertebral arch. This vertebral arch, during the developing, at the first, consists of two semicircles. Look at here, at the first, it is going to be consist of such as this. This anterior particle, anterior segment here, we call pedicle. We call pedicle. And this posterior segment, we call lamina. Lamina. How many lamina we are able to find in a vertebra? 2 lamina. How many pedicle? 2 pedicle. What happened during the development? These 2 pedicle anteriorly are going to attach, to connect to the body of the vertebra. To which surface of the body? To anterior surface or posterior surface?
Posterior.
To posterior surface of the body. 2 lamina posteriorly connect to each other, join to each other, and make a process that we call a spinous process. A spinous process. A spinous process. This spinous process, the tip of the spinous process, at the posterior midline in your patient, you are able to find, you are able to feel. It is palpable part of a vertebra. At the posterior in the midline, the tip of the spinous process are visible, are palpable. Okay? Now, in each side, the pedicle and lamina fuse to each other, join to each other, make 3 processes. One of the process we call transverse process. One of the process we call transverse process. Superior articular process. Superior articular process. And inferior articular process. I'm not able to show you the inferior articular process here because it is not 3D. In the other side, the same. At the junction of the pedicle and lamina, 3 processes are going to be formed. The transverse process, superior articular process, and inferior articular process. You are able to find a foramen. What's the name of this foramen? Vertebral foramen. Vertebral foramen. inside of the vertebral foramen, we are able to find the spinal cord. Here, we are able to find the spinal cord. You know the spinal cord belongs to the CNS, central nervous system. This foramen that anteriorly bonded by the body in the laterally and posteriorly bonded by some structure we call the vertebral foramen. Which structure is going to be found in vertebral foramen? A segment of a spinal cord. You know, each vertebra has a foramen. When these vertebra join and make a vertebral column, each foramen with the other continue and make a canal. We call vertebral canal. Inside of the vertebral canal, we are going to find a spinal. Do you get that? Now, it is a typical. Now look at the picture. In this picture, anteriorly, we are going to look at the thorax. The thorax skeleton are visible here. Anteriorly, a single bone that is a flat bone is visible here. What's the name of this bone? The sternum. How many kind of the bone we have in our body? 3 kinds. Yes? Line bone, short bone, flat bone, and irregular bone. Yes? We have so many subtitles. The sternum is a kind of flat bone. What about the ribs? They are again a kind of flat bone. Yes? In the flat bone, what is the difference between the flat bone and the line bone? The humerus is a kind of line bone. In line bone, for example, the humerus, if you imagine, in the line bone, you are able to find a central canal. Inside of the central canal, you are going to find the bone marrow. But in the flat bone, for example, such as the scapula, you are not able to find a central canal. You have such as this. Inside of all these foramen, you are able to find the bone marrow. And you know, the thickness of the bone in the flat bone is smaller than the other diameter. In the line bone, the length of the bone is longer than the other diameter. Now, in this picture, in each side of the thorax,